Hello, my name is Paul Mullen, and my company StatDebrief is a B2B digital app subscription service for healthcare teams to rapidly debrief smarter and improve healthcare outcomes faster. I am an ER physician at a busy level 1 trauma center. Like in many healthcare systems, we have 3 goals. 1, hospitals want to use resources efficiently so that patients can get high quality, safe care served by staff who want to enjoy their daily work. Like many hospitals, our number one issue that keeps us up at night is whether we will have enough people the next morning to staff our hospitals safely. Like you, we are in a crisis where increasing staff shortages and inefficiencies are driving up costs in healthcare, worsened further by high levels of burnout. Under these conditions, frontline staff have less time and desire to report and problem solve any quality issues that arise during their shifts. This leads leadership to try to problem solve issues on their own, uninformed by frontline input, leading to low buy-in and sustaining of the status quo. This makes it harder to reach our shared goals, all of which makes our crisis worse, and this negative feedback cycle loop continues. We must break this cycle together by problem solving differently in healthcare. Other high-stakes industries like aviation have experienced dramatic improvements in safety and quality by debriefing 100% of the time after they perform their work, because research shows that debriefing improves team performance by 25%. But in healthcare, where our performance is a matter of life and death, and where many organizations recommend debriefing, we find that debriefing happens less than 5% of the time. Why is this? I started a debriefing program with my ER back in 2010 to address a number of quality and safety issues so that we could maximize staff efficiencies and prevent staff burnout that is common when teams cannot communicate to their leadership what it takes to perform their job well. I published the first debriefing implementation article in the literature, and since then I have published more articles in this area than any other clinician worldwide, and I've coached dozens of teams to start their own debriefing programs. Throughout all this, I've realized that we still have 2 problems in getting healthcare teams to realize the power of debriefing. Number 1, healthcare clinicians still lack an easy, fast way to debrief. And number 2, our clinician leaders still lack the time and expertise to start and sustain these programs. Until now, our solution, StatDebrief, is a mobile app and software platform that solves these 2 problems. Here's how it works for clinicians. After your team completes any patient care, whether an intubation, a procedure, perhaps an end-of-shift debriefing after a very high-volume shift with staff shortages, then any team member, whether a nurse, doctor, staff, security guard, pharmacist, anyone can log in through our secure app and guide the team through the debriefing anywhere in your hospital, and it records the discussion. Their input is then transmitted to StatDebrief, which uses AI-powered tools in AWS. StatDebrief then alerts that team's leader in real time that a debriefing has occurred. They log in, review the summary, and resolve any action items. The app then responds back to the team that their leadership is aware of their debrief and is resolving the issues. Now we have 2 heroes. Number 1, the clinicians who are heroes amongst their team and peers for resolving and making work easier to perform well. And number 2, the leaders who are heroes both to their teams as well as to the CFO of the hospital for saving the hospital money. By debriefing smarter and improving care faster, StatDebrief saves time for clinicians by reporting critical issues as a team in as fast as 1 minute, and saves leaders times by problem solving faster, avoiding hours of chart reviews and unnecessary meetings to understand what's happening. StatDebrief empowers teams and leaders to work smarter, ultimately building stronger teams that save hospitals money by decreasing liability risk, enhancing efficiencies, meeting incentive-based quality metrics, and decreasing expensive staff turnover. We have a subscription-based model for hospitals, and we estimate a return on investment of 40 to 1. Our team right now is myself, Lou Page, who built our MVP on AWS, and several advisors with expertise in data security, quality improvement, and research. We believe that StatDebrief will give your frontline teams the ability to debrief smarter and faster. Your leaders can then make informed changes with frontline buy-in that will change the status quo, ultimately improving your hospital's efficiency, quality care for patients, and joy for your frontline. We believe that StatDebrief will help resolve our nation's crisis by decreasing staff shortages, inefficiencies, and burnout. Join us in debriefing smarter and improving care faster with StatDebrief. We have an MVP, and to learn more about how your hospital can get started, please email me or book a time on my Calendly. I look forward to meeting you.